in the 1980s, we were seeing across our different systems children and families who had needs that were impacting, mental health, their education, that were involved in the courts, that were involved with our education system, mental health, behavioral health system, and all these different systems were trying to help these children and families, but they were in separate departments and not necessarily talking to each other.
They had to go to mental health for mental health services for either the minor or the parents. They had to go to adult system to get substance abuse treatment for the parent. They had to go to probation for the criminogenic issues. Then they had to go to education, all in separate doors.
The judge was realizing that all the agencies and departments were kind of operating in their own silos, and so he decided to pull everybody together and establish them to work as a team to break down the silos and break down the barriers to access.
He required or asked that the directors of the youth serving agencies come together and ultimately create an agreement to help support children in Placer's County, which became the Memorandum of Understanding. First one was signed in '88.
It was uncharted territory at that point. I am not aware of any other counties that were working collaboratively to that level in 1988, 87 and 88. It all really did come out of a very strong focus to provide services to children and families collectively.
The early on philosophy for SMART policy was that we were going to invest in preventative measures rather than dealing with the deep end problems that happen. And could we get to these families sooner? And with our collective money, we would basically, the ideal was we would all put the money in the middle and our hands behind our back to figure out what resources, financial resources, and what programs needed to be accessed for a family in order to change their circumstance, to help assist with the traumatic event that was happening.
If they can go one place, come through one door, that's what we really want to do. And then we, in the background, figure out what services are necessary and what the family is asking for, and we deliver it in the most efficient, effective way possible.
Our collaboration and our Memorandum of Understanding that guides us has really helped support this level of continued integration. It's the guidance or the North Star, if you will, about how we'll move our system forward. I think one example might be the introduction and desire to include family voice. So in the early 90s, Placer was one of the first counties in the state to include a family partner who was there to help advise and guide our system.
We all come with our own experience of being involved in system services. So I myself was involved with child welfare. I was in foster care when I was under the age of 18. And so we use experiences like that to engage with young people who are going through something similar. When you bring youth and family voice to the table, it's a way of engaging people in those services and changing that stigma around being involved in system services. It becomes an asset instead of something that people are fighting against.
I can genuinely say that having supports from the county of an integrated team really saved my life and really has saved the lives of many people that that I come into contact with. We're embedded partners in the children's system of care, supporting parents. We are here with our lived experience, and everybody on our team is a parent or caregiver of a child who's received services.
For follow-up?
We really want people to tour through our environments and actually not know who's a county employee, who might be a county Office of Education employee, who might be a community provider, and who might be a youth or a family advocate. We really don't want anybody to know, because it could be any one of us. And what co-location really does for us is it allows those on-the-spot, moment-by-moment pieces of collaboration and communication to happen.
We could have a challenging situation going on, and members from different teams will pull together and brainstorm, come up with a plan together to identify what is most appropriate to help provide the resources and help that youth through that struggle, help that family through that struggle.
One of the things that SMART also allowed us to do was to share our funding, share our ways of doing outcomes measurement and tools, but also share our data. We have a permanent modification and amendment in Welfare and Institutions Code that actually allows the Placer waiver, the Placer system of care, to operate the way that it does. Whenever we do have, say, funding challenges, that's also, we are so well positioned to weather when we have recessionary challenges, or when we have grant funding that actually ends, or when some state funding doesn't get renewed. We as a collaborative can then really work together to ensure that we know what our really critical, important services are, and then figure out a different way to fund them.
The Crisis Resolution Center, I believe they opened around 2002, but it's a great example of the partnership. It's an example where probation and Children's System of Care braid funding to help finance the program. They serve youth 12 to 17 years old. They work with the youth and the families. It's a 6-bed facility. So they offer counseling, they offer respite where the youth can actually be there. And they're great at providing tools and resources to help these youth and family to divert the system. The goal is that it's early intervention, it's prevention. It's to keep them from getting into the juvenile probation world. So we're funneling resources to help at that front end and make sure that they're successful and they're healthy and they stay out of the system.
I thought that things were going to get better.
We're ahead of the game. Since we've been doing this, I think in the early, if you look back to the 80s, 40 years, thankful for that judge that pulled everybody together to initiate the collaboration and communication, set the expectation. And we have all the right people in the right positions so they care about making a difference. And that really helps keeping that going forward. No system should be working in silos and not working with each other. And that's why I feel so lucky to be part of a system that was already established.
The MOU is simply a piece of paper. It's the relationships, our collaboration, our evolution of our system of care that really allows for good outcomes for children and families. It's not perfect. I think the example we can give other counties is that we stick with it, we keep trying, we keep forming relationships, and that's what's important for those outcomes for children.
There are a number of challenges that make it difficult for different agencies with different disciplines to work together. One is just we have different disciplines and different ways of perspectives on things, different languages, different regulations and laws that we have to be compliant with. It can be challenging, but that is what keeps us going, the North Star of saying that this is really what's best for the children and families, and the investments that we've made over the years have really made an impact. So we look at outcomes and to see that we have a lot of really positive outcomes here in Placer that are a result of that hard work from decades ago. So we really want to continue that and to build a legacy, continue that legacy for generations to come.